Cancer, everything you need to know to protect yourself and win this battle. Have you ever wondered why cancer arises in the human body? Why does it seem like younger and younger people are experiencing this disease? Could our daily habits, such as what we eat and breathe, influence that much? Cancer is one of the most studied conditions in the world, but it is still surrounded by doubts and mysteries. It doesn't choose age, gender, or social class, and that makes it a topic we all need to understand. In this video, we will explore everything from what cancer is to how it affects the body, the warning signs, and the impact of our habits. Let's understand what science has already discovered and what still remains unanswered. Let's get started. Cancer, what it is and why it can develop in your body. Cancer is a condition in which the body's cells begin to multiply in a disorderly manner, exceeding normal growth limits. This occurs due to changes in the DNA of these cells, which can be caused by external factors such as exposure to cigarettes, pollution or chemical agents, and internal factors such as inherited genetic mutations. In a healthy body, cells follow a life cycle. They are born, fulfill their function, and die in a programmed way. This balance is maintained by genetic regulation mechanisms. However, in a cancer cell, these mechanisms fail. It not only grows uncontrollably, but also develops dangerous abilities, such as the ability to invade surrounding tissues and spread to other parts of the body, forming metastases. Cancer cells are not foreign invaders, they are our cells that have mutated. This makes the treatment complex, as it is necessary to destroy these diseased cells without affecting healthy cells. Although it is a frightening disease, understanding the risk factors and mechanisms of cancer is the first step to preventing and treating it. Studies show that healthy habits and regular exams can significantly reduce the risk of developing the disease. But did you know that cancer doesn't appear suddenly? It is the result of an accumulation of changes over time. Discover in the next topic how our immune system works in this process and why it sometimes fails. Your immune system. vs. Cancer, the game of life and death. The immune system is like our body's bodyguard. It constantly patrols for invaders such as viruses and bacteria, as well as abnormal cells, including cancerous cells. When a cell mutates and starts behaving abnormally, the immune system usually recognizes it as a threat and tries to destroy it before it causes problems. However, cancer cells have strategies to evade this defense mechanism. They can camouflage their characteristics, becoming invisible to the immune system. Furthermore, many of them release substances that suppress the immune response, preventing the body from attacking them effectively. Another worrying factor is that in some situations, the immune system itself may be weakened, whether due to age, chronic stress, poor diet, or conditions such as persistent infections. This vulnerability increases the risk that abnormal cells will grow and multiply out of control. In addition to evading detection, cancer cells are extremely adaptable. They can modify themselves to survive in different environments of the body, such as other organs and tissues, during the metastasis process. This ability to adapt challenges not only the immune system, but also available treatments. However, medical advances have brought new hope. Immunotherapies, for example, are treatments that stimulate the immune system to recognize and fight cancer more effectively. These treatments have shown promising results, especially in types of cancer that were previously difficult to treat. But how do these cells escape so easily, especially in younger people? In the next topic, we'll explore why cancer appears to be becoming more common among younger generations. Why are more and more young people being diagnosed with cancer? Historically, cancer was more associated with older people. This made sense, since the genetic mutations that lead to the disease usually accumulate over time. But in recent decades, there has been a significant increase in diagnoses in young people, often between the ages of 20 and 30. This change has raised many questions. Have cases really increased, or are we just diagnosing them earlier thanks to advanced exams? The answer probably lies in a combination of factors. One of the main suspects is modern lifestyle. Exposure to ultra-processed foods, rich in preservatives and chemical additives, has been associated with an increased risk of cancer. Furthermore, the use of electronic devices and living in urban environments increase exposure to pollution, radiation, and other carcinogens. Another important point is the impact of stress and a sedentary lifestyle, which are increasingly present in the routine of young people. Chronic stress can weaken the immune system, while lack of physical activity contributes to obesity, another important risk factor. However, not all cases can be explained solely by environmental factors. Genetic changes, often inherited, also play a crucial role. Some young people carry mutations in genes that make them more vulnerable to developing cancer at an early age. These mutations, combined with external factors, create a favorable scenario for the disease to emerge. What worries experts is that, despite advances in treatments, there is still a gap in awareness and prevention in younger people. This makes it essential to adopt healthy habits and have regular checkups from an early age. But is genetic predisposition enough to determine someone's destiny? In the next topic, we will explore how genetics influence cancer and whether we can change its fate. Genetics and cancer. Is your destiny written in the genes? Genetics plays an important role in the development of cancer, but it is not solely responsible. Although some people have inherited mutations that increase their risk, this does not mean they are destined to have the disease. In fact, most cancer cases are caused by a combination of genetic and environmental factors. Mutations in specific genes, such as BRCA1 and BRCA2, are associated with types of cancer, such as breast and ovarian cancer. These mutations can be passed from parents to children, increasing the likelihood that cancer will occur in future generations. However, only a small percentage of all cancers are directly related to hereditary mutations. What makes the issue even more complex is the fact that cancer often results from mutations acquired throughout life. These mutations can be triggered by exposure to substances such as tobacco, ultraviolet radiation, or even natural errors in the cell division process. In other words, even without a family history, anyone can develop cancer depending on the factors to which they are exposed. Furthermore, the interaction between genes and the environment is a key element. People who have a genetic predisposition may never develop cancer if they adopt a healthy lifestyle and avoid known risk factors. On the other hand, people without a genetic predisposition can develop the disease due to lifestyle choices or environmental exposures. The good news is that advances in genetics have made it possible to identify these predispositions with greater precision. Genetic testing can help assess individual risk and guide prevention measures. But even with this powerful tool, it's essential to remember that genetics is not an immutable destiny. She is just one piece of the puzzle. Understanding how genes influence cancer is just the beginning. In the next topic, we will talk about the first signs that the body can give and that you should not ignore. Signs of cancer that may be going unnoticed. Cancer can develop silently for years before showing obvious signs. Therefore, identifying the first symptoms is crucial for an early diagnosis and consequently greater chances of successful treatment. Unfortunately, many of these signs are subtle and often ignored or attributed to other, less serious conditions. One of the most common signs is unexplained weight loss. If you're losing weight quickly without dietary changes or increased physical activity, this could be a red flag. Extreme fatigue, which does not improve even with rest, can also indicate that something is wrong in the body. Changes in the skin, such as the appearance of blemishes, wounds that do not heal, or changes in moles and moles, are symptoms that should not be underestimated. These changes may be signs of skin cancer, but they may also reflect problems with internal organs. The presence of nodules or swelling in areas such as the breast, neck, armpits, or groin is another sign that deserves attention. Not all nodules are malignant, but any abnormalities should be evaluated by a doctor. Likewise, persistent pain that has no apparent cause may be indicative of early-stage cancer. Symptoms such as difficulty swallowing, persistent cough, blood in the stool or urine, and changes in bowel habits can also be warning signs. These symptoms are often related to other health problems, but it is essential to investigate them to rule out the possibility of cancer. Many cases could be diagnosed at an earlier stage if people were more attentive to these signs. The key is to know your own body and seek medical help when you notice something out of the ordinary. But how can everyday choices further reduce the risk of developing cancer? In the next topic, we will talk about how lifestyle can be a powerful barrier against this disease. How your lifestyle can be a barrier against cancer. Although cancer can arise due to genetic factors or random mutations, lifestyle plays a crucial role in prevention. Studies show that around 40% of cancer cases can be prevented with simple changes to daily habits. A balanced diet is one of the pillars to reduce risk. Prioritizing natural foods, rich in fiber, vitamins, and antioxidants, such as fruits, vegetables, and whole grains, strengthens the body. On the other hand, avoiding excessive consumption of processed meats, refined sugars, and ultra-processed foods helps to minimize exposure to carcinogenic substances. Keeping your body moving is also essential. Regular physical exercise, even moderate exercise such as walking or cycling, can reduce the risk of various types of cancer. Physical activity helps control body weight, reduces inflammation, and improves the immune response, factors that play an important role in disease prevention. Another determining habit is avoiding smoking. Smoking is responsible for a large portion of cancer cases, mainly in the lungs, but also in other organs, such as the bladder, esophagus, and mouth. Quitting smoking is one of the most impactful decisions you can make to protect your health. Additionally, limiting your consumption of alcoholic beverages is a wise choice. Alcohol, especially in large quantities, is associated with an increased risk of liver, esophageal, and breast cancer. Adopting moderation or completely avoiding consumption can make a big difference. Quality sleep and reducing stress also have an impact. Sleeping well allows the body to regenerate and maintain an efficient immune system, while relaxation techniques such as meditation and yoga help reduce levels of cortisol, a hormone that can weaken immunity. Adopting a healthy lifestyle is not a guarantee against cancer, but it is one of the most powerful tools we have to reduce the risk. In the next topic, we will understand how early diagnosis can be the difference between life and death. Early diagnosis, the key to cure cancer. Early diagnosis is one of the most important factors in increasing the chances of curing cancer. When identified at an early stage, cancer is generally more treatable, less invasive, and has a significantly higher success rate. Therefore, recognizing the importance of regular exams and paying attention to the body's signals can save lives. Many types of cancer, such as breast, prostate, and cervical cancer, can be detected early through specific tests. Mammograms, PSA tests, and Pap smears are examples of powerful tools that help identify changes before symptoms even appear. Additionally, colonoscopies and fecal occult blood tests have been instrumental in the early detection of colorectal cancer. Another promising resource in diagnosis is advanced imaging, such as CT and MRI scans, which allow internal structures to be observed with high precision. These technologies help locate tumors at early stages, increasing the chances of effective treatment. However, adherence to routine exams still faces challenges. Many people postpone appointments due to fear of diagnosis, lack of time, or even lack of knowledge about the importance of prevention. This neglect can allow cancer to progress to more difficult-to-treat stages, significantly reducing the chances of success. In addition to exams, awareness of family history is crucial. People with close relatives who have had cancer should tell their doctors, as they may need more frequent monitoring or genetic testing to assess their risks. Early diagnosis not only increases the likelihood of a cure, but also reduces the need for more aggressive treatments, which can have significant side effects. In many cases, early detection allows for minimally invasive interventions, which preserve the patient's quality of life. But what happens when cancer is discovered too late? In the next topic, we will explore advances in treatments that are transforming the fight against this disease. The revolutionary treatments that are transforming the fight against cancer. Cancer treatments have evolved significantly in recent decades, bringing new hope to patients and families. While in the past the options were limited and often aggressive, today we have more precise and personalized approaches. Chemotherapy and radiotherapy, although still widely used, have undergone advances that have made them more effective and less invasive. Modern chemotherapy drugs aim to target cancer cells directly, sparing healthy tissues to a greater extent. Likewise, radiotherapy has evolved with technologies such as intensity-modulated radiotherapy, which concentrates radiation on the tumor, minimizing damage to the surrounding area. Immunotherapy is one of the most promising innovations. It stimulates the patient's immune system to recognize and fight cancer cells more efficiently. This approach has shown impressive results in cancer types such as melanoma and lung cancer. Another revolution is targeted therapy, which uses drugs designed to attack specific mutations or proteins present in tumor cells. Instead of affecting the entire body, these therapies are targeted, causing fewer side effects and being more effective in certain cases. In recent years, precision medicine has also gained prominence. Based on genetic sequencing, this approach analyzes the genetic profile of the tumor to choose the most appropriate treatment for each patient. This means that two people with the same type of cancer can receive completely different treatments, tailored to the unique characteristics of their tumors. Furthermore, gene therapies are in the development phase. They aim to repair or replace defective genes that cause cancer. Although still at an early stage, these therapies represent the future in combating the disease. Finally, advances in minimally invasive surgery, such as robotics, allow for the removal of tumors with greater precision and faster recovery for patients. Despite all this progress, access to the most modern treatments is still unequal. The next step in the fight against cancer is to ensure these innovations reach all patients, regardless of their location or financial status. But what is true and what is myth when we talk about cancer? In the next topic, we will clarify some of the most common questions about this disease. What is true and what is myth about cancer? Discover now. Cancer is a complex disease, and over time it has become surrounded by myths and misinformation. These misconceptions often create unnecessary fear or cause people to ignore important signs. Uncovering what is fact and what is myth is essential so that we can face the disease with more clarity and confidence. One of the most common myths is the idea that cancer is always a death sentence. Although this statement has been true in the past for many types of cancer, advances in medicine have allowed for increasingly higher cure rates, especially when diagnosed early. Today, many people are able to live for years or even decades after treatment. Another common myth is that cancer is contagious. That's not true. Although some infections, such as HPV or hepatitis B, can increase the risk of cancer, cancer itself cannot be passed from one person to another. Many people also believe that all types of cancer have clear, noticeable symptoms. In reality, cancer can be silent for a long time, which makes preventative screenings even more important. There are those who think that consuming sugar feeds cancer. While it is true that cancer cells use glucose for energy, just like all cells in the body, there is no evidence that reducing sugar consumption can cure or prevent cancer. The important thing is to maintain a balanced and healthy diet. On the other hand, it is true that certain environmental factors, such as smoking, unprotected sun exposure, and contact with chemical substances, significantly increase the risk of cancer. Therefore, it is essential to adopt protective measures, such as stopping smoking, using sunscreen, and avoiding contact with toxic agents. Another important fact is that not all forms of cancer are hereditary. Most cases result from mutations acquired throughout life, rather than genetic predisposition. Demystifying cancer is a crucial step towards empowering people to make informed decisions about their health. Now that we know what is true and what is not, how can we imagine a future without cancer? That's what we'll talk about in the next topic. Prevention and hope. how we can imagine a world without cancer. A world without cancer may seem like a distant dream, but advances in science and prevention strategies show us that it is more possible than we imagine. The combination of healthy habits, early detection, and innovative treatments is already saving millions of lives each year. Prevention is the first step on this journey. It is estimated that a significant portion of cancer cases can be prevented with lifestyle changes. This includes a balanced diet, regular exercise, smoking cessation, and moderate or no alcohol consumption. Furthermore, protecting yourself from excessive sun exposure and avoiding polluted environments are also essential measures. Another fundamental aspect is vaccination against viruses that can cause cancer, such as HPV and hepatitis B. Immunization campaigns have shown impressive results in reducing cases related to these infections, especially among young people. From a scientific point of view, the advances are promising. New technologies such as CRISPR gene editing are being studied to correct mutations that lead to cancer. Additionally, researchers are developing personalized vaccines to train the immune system to fight specific tumors. While eradicating cancer is a monumental challenge, there are historical examples that inspire us. Diseases that were once fatal, such as smallpox, were controlled thanks to the advancement of science and global mobilization. Likewise, awareness and collective efforts can transform the way we face cancer. But the fight is not just scientific. It also involves overcoming access barriers. Making modern treatments accessible to everyone, regardless of their location or financial condition, is one of the biggest challenges and priorities for the future. As we work toward this ideal world, we need to act in the present. Adopting preventive practices and supporting scientific research are concrete steps that each of us can take. A cancer-free future is not only possible, it is built from today's actions. Now, how can we bring all of this together into a message of inspiration and motivation? We will close with a powerful reflection in the next segment. Cancer is, without a doubt, one of the greatest challenges of our era, but it is also an opportunity for collective overcoming. Every advance in science, every healthy choice, and every early diagnosis brings us closer to a future in which this disease is no longer a reason to fear. You have the power to take care of your health today, to know your body's signals, and to make decisions that can change your life. Prevention starts with every daily choice, and science advances thanks to the support and awareness of people like you. If you or someone you know is facing this battle, know that you are not alone. There is a community of health professionals, researchers, and families united in the search for solutions and hope. Remember, cancer doesn't define who you are, but how you face challenges can inspire change and save lives. The power to transform is in our hands, and the future can be brighter than we imagine. Be vigilant, take care of yourself, and believe in the power of science and human determination.